Hey folks, how are you doing? Good to see you again today. And today, we're going to be talking about um, important discussion, about mental health that concerns everyone and starting from childhood, starting from pregnancy, especially, children, with mental health concerns like ADHD, like autism. At times it starts, from even pregnancy. When you look at the factors or the predisposing factors or the causes of some of mental health concerns that impact children, and at times it's carry over to adulthood. So it is important, like I always say, wellness, overall well-being, and to pay attention to everything about our health. So, like at times from pregnancy, if the an individual is pregnant, could be due to exposure to some virus, to some toxins in the environment, to even like toxins like cigarette smoking, alcohol use, illicit drug, recreational drug, marijuana, and all that could impact, the growing baby. And at times, nature harm is very complex that people may even be pregnant, they are not aware yet that they are pregnant, and they are exposed to all those things which could impact the life of that unborn baby, and causing some mental health concerns, like ADHD, like I've said, like autism, like some mental health concerns that maybe they're able to outgrow it as they are growing. Hi, sorry, there's one cute baby that is saying hi to me. I'm sorry. So, um, I'm sorry for that distraction. It's just a little cute baby, and I do want to show, the cute in my video. So it is important, but like when we pay attention to our body, we'll be able to know where we go, especially as ladies, or some other things. Even some people, it could be due to like low folate. I see a lot of kids that may be due to low iron. It's not that they are not eating well, it's just that, their own, it may be genetic, it may run in family. That some people, they have some like mutation, or like certain mental health or physical or medical conditions that is peculiar to that family, and it could impact their mental health, like we have mentioned before. So seeking help or receiving help, it takes, the entire family, like family support, friends, peers, to encourage these people, so that one, we need to even acknowledge first that there is a problem. So that acknowledgement that, oh, there is a problem, is then that people could think, okay, we need to seek help for this problem. And apart from that, yeah, like recognition as well, that, like all these childhood disabilities, we could tell even from few months, like babies, some like from early childhood, few months after birth, like 6 months. Even before then, you see the interaction, like before age 7 years, you see like autism, even under a year and all that, that the child, the social interaction, the communication, and you could know, even if it is your, first child, you've seen babies before, the way babies, respond, to interaction with other people and all that, or even with stranger. And it is good, to recognize, not to be in denial that, oh, okay, yeah, people are different and all that. That makes it's a bit difficult as time passes on. Yeah, but when we seek help on time, it's the treatment, like getting it on time, yeah, is what I am trying to say. So it's important that we pay attention to be able to recognize that, oh, there's things are not going as expected here, and that is able to be fixed on time. Yes, we know there are some of this problem, once they start, maybe due to genetic, maybe due to certain situation that happen, like, okay, difficult delivery, prolonged labor, complications of pregnancy, like gestational diabetes, high blood pressure in pregnancy. All those could impact the development of the baby and could impact, causing some mental health concern when that baby is eventually born. And also, as I've said, exposure to viral uh, um, the organism in the environment, toxins from lead, from paint. So we need to protect, the young ones, right from pregnancy to when they're little babies and in their childhood, so that we it will not complicate, life for them, and they can settle down in life smoothly. But at times, people, it's not that they willingly, want to put their loved ones, their babies in problems they know not better. And that is why we're doing this for educational purposes, to bring awareness, and that help is available. If you see that things are not going right, that child is not responding to communication, eye contact, likes to isolate, likes to just be fixated on things, and you is there's no question in life that is stupid. Yeah, and it is better to take, to be on the side of caution, that, oh, I just want to check, and then you check, they say, oh, nothing's wrong, than, going late and they say, oh, you have delayed so long, you're supposed to have, check in at this very time. So it's important, to take interest, to pay attention in the health, in the wellness, in everything, like there's a way that we expect, babies, depending on their different ages. And as we said, there is no harm in asking questions. There's no stupid question as it pertains to life, as it pertains to health. And the professionals are always willing. That is what our license is all about. It's about the public safety. The government wants to keep the people safe, and they've entrusted, that the license into our hands to be able to take care of people, to make sure that, oh, people are safe in our hands, we can educate them. And most of the time, like these children as well, they just need, like a kind of, we call it, the modality of therapy we use, cognitive restructuring, like helping them to the way they behave, behavioral modification, like social skills. And we do it repetitively and follow a framework. And that child, because the nervous system is very complex, but it's able to be retrained, especially when we start early. So children with disability, mental health providers, mental health professionals, yeah, and wellness coach, counselors, we are here for you. But you need to reach out. You need to recognize there's a problem, and that recognition, brings solution to some extent. And as the child is growing, then they are going to catch up eventually with their peers, and they are not going to feel bad that, oh, mom and dad should be able to do this on time. And also, there are some that, if they are missed, if the diagnosis are missed in early childhood, they carry it into adulthood. It impacts their productivity, it impacts their life, even like the spouses too, sharing the burden. So this is why this educational video, to let us know, to make great awareness and enhance, the knowledge people have before, that most of the mental health that people have from childhood, it actually started right from pregnancy, or like it is missed in childhood, and that can be fixed once we ask for solution on time. As I said again, my name is Dr. Debbie. I'm your wellness coach, and I'm out this weekend, as usual, for my health work, my fitness work, and I appreciate you joining me in my fitness work today. As I said, emotion is good. When we move our body, we move our system. Emotion, it's move our emotion too. All those feeling down, feeling sad, feeling unhappy, feeling frustrated, a lot of stress, that we've gone through Monday to Friday. Let us release some of them, during this weekend, and so that we prepare our body to, for wear and tear, replacement, rejuvenation, and we can be full of life, get ready for the new work, a new week, and be productive and enjoy, the interaction with our loved one. We don't need to be shouting, screaming because we are tired, because we are exhausted. So, as I always say, emotion, move, exercise, get out. The weather is getting warm, the weather is getting beautiful. Move, exercise, and this also impacts your overall wellness and well-being. All right, thank you so much for hanging out with me today. Until I see you again in my next video for my um, health walk, and that will be next Saturday as we always do. Thank you and have a good one. Bye.